Hello, my name is Nicola Carey and I'm a reader in long-term conditions at the University of Surrey. Today I'm really pleased to be able to talk about a piece of work that I undertook as part of my Florence Nightingale Scholarship Award last year. This award was designed to explore how infection is detected and managed in different parts of the world. And this paper that I'm going to report on today explores the results of a survey which explored nurses, care workers and managers' views around the use of decision support tools to help improve the infection of detection in nursing homes in these countries. So just to provide some background information, as I'm sure we're all aware, the older population around the world is increasing, particularly those aged over 85. This part of the population, as we know very well, after the last few months of COVID-19, are at heightened risk of infection, and if they do detect an infection, very rapid deterioration of their condition. As a result, they experience many unplanned admissions, and this obviously has implications on resources and service requirements, and more importantly has an impact on the individual, many of whom never recover from their illness that they're admitted with. What we know about improving infection detection is that there are key aspects that we need to consider. One of which is that the early identification is critical to success. Observational assessment is also very important in this area of work, and the use of decisions support tools, also known as checklists, can really help staff members, particularly those who are non-registrants, such as care workers, identify when residents have got a problem. What we know so far is that our colleagues in Sweden have developed a checklist which has been tested in Sweden, which has been shown to be very useful. This checklist is called the Early Detection of Infection Scale, and through conversation with these colleagues, we started looking at whether it would be of use in the UK and elsewhere around the world. And this led us to the survey. So the aim of this survey is to collect preliminary data to explore how infections are detected and managed in practice in different parts of the world, and use this to inform our strategy going forward. So the survey is exploring these different aspects: staff views on the type of infections and how they're managed, current challenges, suggestions for improvement, what their training needs are and educational needs, have they got unmet training needs, how aware are people of decision support tools, and are they aware of any support tools for detecting infection at the moment. So we developed a survey with our colleagues at Linköping University, and it became available online and also via a paper-based copy. We collected data during 2019 up till 2020 and obtained ethical approval in each country before proceeding with data collection. At the end, we were delighted to say that we obtained a convenient sample of nurses, care workers and managers employed in nursing homes from England, Spain and Sweden. People were recruited from nursing homes via our professional contacts and networks until the target number of responses in each country was obtained. And we were hoping to get around 50 responses in each country. As it's really a scoping survey, we didn't really need to do a sample size calculation. And at the end, we had 70 responses from England, 60 from Spain, and 74 from Sweden. So we had a total sample of 204 responses, and this is the basis of the results that I'm going to present to you today. So what we can see from the demographic profile of the sample is that the vast majority, 85%, worked as care workers, a smaller number were nurses, and only a few were managers. The population had considerable experience, with 38% having more than 10 years, and 85% were working more than 30 hours per week. The first set of questions that we asked were about the different types of infections that they experience and the different changes in behaviours that they associated with residents who had suspected infections. And you can see from the chart on the left that there are very high frequencies of all the different types of infections in each country. The chart on the right shows the different types of behaviour that people experience when they have suspected infection. And again, very high responses and obviously some differences within the countries, which is interesting to note. We then asked participants about what actions they would take when residents have a suspected infection. So you can see from this slide that the most frequently reported activities were reporting to a senior colleague and/or recording in the records. And again, there was some difference between the countries, and you can see here that in Spain, the most frequently reported action was reporting to a senior colleague. And here, recording in the records was actually only 50% of the sample. And there was, as you can see, some significant differences between the different types of actions that were taken between countries. We then asked participants about what they felt the most important action was to help improve the care of residents with a suspected infection. And you can see here from this bar chart, and it shows it very clearly, that having an adequate level of staff and having improved instructions about what to do and improved continuity of care were the top 3 priority areas. And that was the same across all the countries. We then asked people about their education and training. Now, 3/4 had undertaken relevant education and training around infection detection. Most commonly reported was a diploma or certificate and experiential learning. 92% of the population reported that they found it very or somewhat useful. But interestingly, over half of our sample had unmet training needs. And more concerningly, nearly a third had only undertaken training more than 2 years ago. So that's quite a long time. So our next set of questions were asking around decision support tools, knowledge, awareness and usage. So we asked participants, were they aware of decision support tools, and do you use decision support tools in your nursing homes? And as you can see, very high percentages were aware of decision support tools, and again, similar high percentages were using. And again, you can see this broken down by the country, but there isn't any particular differences between each country on these 2 questions. So when we asked about the areas where they were using decision support tools, this is what our participants reported. So the areas were around pressure sores, falls, pain, nutrition and oral health. And you can see actually what is of interest here is that the UK is reporting a much higher frequency of using these decision support tools than Spain and/or Sweden. And interestingly, that a very large percentage in each country found them very useful or somewhat useful. We then asked participants about decision support tools specific to infection detection. So as you can see, the number reporting here was quite a lot lower, only 50% or lower in each country were aware of any infection-specific support tool. But then what is really encouraging is that nearly 90% or over reported that they would find a decision support tool checklist helpful in identifying infection. And again, there was no difference between the countries in either of these responses. So the conclusions that we found is that decision support tool checklists for improving early detection of infection would be a useful resource to help overcome common issues, reduce unplanned admissions, length of stay, and save money for the global healthcare economy. And our next steps are to explore the content of the EDIS tool developed in Sweden and make necessary revisions for each country, and then to test it in practice. Thank you very much for listening. And for those who are interested, I've provided some background references on the EDIS tool and also a protocol paper that we've written about the survey. Thank you very much.